Hello, dear one. I'm Dr. Tatiana Lagransky from Israel, and for the next hour, I will share with you two topics. My personal experience of kidney tumor natural healing and GNM as a prevention of chronic disease. I'm so grateful for Dr. Hammer that brought to our world so brilliant wisdom that changed the life of many, many people. Thank you for every one of you that participate in our celebration of this day of German New Medicine. Gratitude for Global GNM, gratitude for Dr. Verghese and his team, and every one of colleagues that going to speak in this day. I highly recommend it to hear all the 24 lections of my colleague from all the world, because every one of us brings something special, brings something individual, some special understanding of German new medicine. It's a beautiful day. I'm Dr. Tatiana Lagransky. I'm a medical doctor for more than 30 years, and I'm a specialist in family medicine for 25 years. I'm owner of the Natural Healing Clinic, the best doctor. In our clinic, in our center, we are practicing a lot of practice and technique of natural healing, like energetic healing and emotional healing. And of course, is the star of our clinic, it is German New Medicine. I'm a practitioner, so grateful practitioner and teacher of German New Medicine. You can ask me what happens, how is medical doctor going through this way and coming through natural healing. I think it was a very natural process. Many years ago, when I finished my study in university after 7 years of study in university, and I came to Israel. I actually was born in Russia, and I came to Israel, and I started here my specialization in family medicine. I was so happy because I think after finishing my specialization, I can really, but really to help for people. And this moment came. I started to work like a family doctor in some clinic in the center of Israel. And you know, the day after day, clients, patients came to me, and I started to understand that I know so little information about these people that came for me with his pain. One day came some young man with back pain, and we did all evaluation, and I prescribed it treatment. It's analgesic treatment, but after 1 month, it doesn't finish. This guy coming once and once again and once again, and I asked me, what is the cause? Why this young man need this pain? What happens? And it was the same with many people that coming to me with urinary tract infection, with fibromyalgia, with hypertension, so many, as we call it, is disease. And I didn't have understanding why one people take the same pills and go through the process and feel better. And the another people can take the same meditation, but nothing help for him. Nothing happens. And sometimes I saw that the people can die from some diseases, some symptoms. I have so much question about what happens here, and I starting to search for answers for my questions. And I started to learn energetic healing and traveling on our beautiful world and learning from beautiful natural healing teachers. And I started to work in natural healing clinic. Yeah, it was parallel. I working on like a family doctor, and I starting to work on private way, like a natural healing. It was much better and effective. And I saw that people starting to feel better and to come out from chronic disease or chronic symptoms. I felt great till one day that one man, approximately 50 years old, came to me and said, half years ago, I was in your clinic and I was with hypertension, and we do the work, and it was working and it was beautiful. But after half of year, I have my hypertension again. And now I'd like to ask you, and I like to ask me, what is the original cause of this? I don't interested in some energetic or emotional healing. I want to understand, to really understand why the blood pressure in my body is not normal, why it is going high. You know, I was in some situations that it was, wow, I can tell you exactly, I can tell you why it happens intuitively, but this young man want to know this logically. And I sitting on my clinic and I asking from universe, help me. What can I do with this situation? What answer can I find? And some months after this, I see on the internet something about German new medicine. And it was like one, wow, it's so interesting. It's so interesting. And because I'm a doctor, it was, you know, it was like two different things. From another side, from one side, it was so many explanations about processes is going in our body. But from another point, it was so different from conventional knowing that I have, like, as a doctor. Now, there are so many years after this situation, I starting to dive in this knowledge, and I starting to understand more and more what happens with my body, what happens with the body of the people that came to our clinic, the best doctor. You know why the name of our center, our clinic, it's the best doctor? Because it is you, the best doctor of yourself. It is your body, the best doctor. All the healer, all the teacher, all the doctor only can help to go for your natural process. And it was beautiful. We continue to work in our center. I say me because it's me and my beloved partner. Both of us, we are working together. He is healer and GNM practitioner for years. And almost 7 years ago, I think it was the big exam of this knowledge in my life. I woke up in the morning and I woke up with the pain in my low right abdomen. And I think maybe the pain, it was greater and greater. It was a very big pain. And I decided to check what happens there. Maybe it's appendicitis. And I go to the hospital to my friend, and I did the computer tomography of abdomen. And I came back home and waiting for the answer of this. And in the evening, my friend radiologist called to me and say, you don't have appendicitis. It's no inflammation there. You don't have, because I think about some diagnoses. You don't have this and you don't have this. But what I see in your left kidney. It's not the same side when I have pain, and the pain was much better in the evening. On your left kidney, I see a tumor of 2.5 centimeter for 3 centimeter. And it's sitting on the upper side of upper part of your kidney. And it seems like malignant tumor. It seems like renal cell carcinoma. Of course, I was shocked. But he said, but it's nothing. You're going to take out your left kidney and maybe you're finishing with this tumor. It was great shock for me. From one side, I was in dilemma. From one side, I know how kidney tumor should be treated in conventional medicine. On the first days after evaluation, it was not so simple decision. I decided not to do operation. I decided to go through the natural healing process. As I know, and maybe as you know, the first thing that we need to find, it's the original cause, the biological conflict that make my left kidney to growing this tumor. And I sat with myself and asked, Tatiana, what happens here? What is your life? It's not going biological. And I found the answer very quickly. It was biological conflict of abandonment and refugee. It was situation in my work. I felt not understood, refuged, outside, isolated, rejected. I felt like, alien, because from my perception, I saw all the system and all what happens to people from another perspective. And you know, I was very successful doctor with a great practice in many people that like to come to my clinic. It's something from outside didn't see it. It was my personal assessment. It was my personal feeling was what happens with me. And it was like, this is your conflict. On the same moment that I understood what happens to me, and I decided to do the change, to go out from this workspace, my natural healing process was started. For people that studied German new medicine, I can explain more about what happens to me. It was kidney collecting tumor, and it's actually originated from endoderm. Thank you so much for Caroline, for this beautiful scan from her side. It's beautiful graphic compass of German new medicine. It's endoderm, and we see in the endoderm, it's cell proliferation in conflict active phase. And the same time, I was in conflict active phase. It was conflict of abandonment and refugee. And when the moment I understood my conflict, and when I decided to do the change, this moment it's starting healing phase. I went to the best solutions that I can to do the change, to go out from this walk. On the moment of my decision, it was conflictoris. And in my body and in my psyche and in my brain started PCLA phase. And it was inflammation and it was pain. It was very interesting. At the same time, I have inflammation, very big inflammation on some teeth that in the Chinese medicine and the teeth of the left kidney. And on the starting, it was some pain, inflammation, and after this, it was better. I didn't feel any pain or any prominent symptom. And I continue to do follow-up. After 1 month, I did MRI because, you know, for doing operation, I need MRI, as I did. And in MRI, it was a little bit smaller size of this tumor. And after 3.5, 4 months, I did additional computer tomography of my kidneys. And they find only scarring on this place, the tumor of 2.5 on 3 centimeter was here. And after this, I'm going follow up every 1 year, and I'm 7 years after this situation, and my kidneys are healthy. If it is something miracle, mystical happens for me, no. It's as a work of 5 biological laws that Dr. Hammer brought for our world. Let's dive for this more. Now we are going to speak, we're talking about my personal experience of natural healing process of left kidney tumor. And now I want to speak with you about how do we create chronic diseases and how can we finish biological program quickly. After this session, you can take with you 3 very simple and very effective technique that can help you to finish the biological program quickly. Sometimes I find myself in my clinic that patient sitting above me and ask me which approach is correct. If it is German new medicine, or if it's conventional medicine, or if it is Ayurveda, or it is homeopathy, what can decide what to do? Let's see. You can see here cylinder. And it's like ask if it's cylinder on the wall, it's a square, or if cylinder on the wall, it is a circle. What is a big question? But the answer is so simple. If you put the light, our perception from this side, we can see square. And if we put the light from this side, we can see the circle. And which of them is correct? Both of them. We can choose our perception. We can choose our explanation about the same situation. When we're talking about German new medicine, I think we need to understand some very profound things. We're talking about me, my experience. What is a me? I'm Tatiana, I'm a medical doctor, I'm vegetarian, I'm mother, I'm partner, I'm a lot of things that I studied in my life. I understand a lot of things. And everybody of us have my body. And what it is my body? My body, it's like a little child. Little child till I think age of 4, 5, the child that react for everything so naturally. His reaction, it's so reactive, like if we scary as him, if it's don't want to eat something and it's like say that. It's not politically correct. This child is not politically correct. This child is not socialized. He live his natural life and feeling. Our body react for the world, for the situation, like a child. And this body went through millions of years of evolution. And every cell in our body is plain of wisdom. It's like, a big fabric and big working machine that know to correlate one with other. If now, in this moment, we are alive, I think this evolution was successful. And our body have basic biological needs for survival. It's breathing, it's to drink water and take out water. It's food to eat and to take out. It's protection. It's reproduction, because we live in the group. We know not alone, its stability and its social hierarchy. From the first moment in our life, we are coming to social hierarchy. It's baby, mother, father, brother, sister. It's school. It's, partner, boss, my client. It's everything, and my pet. Every day we checking our social hierarchy. And if it's basic biological needs was satisfied, our body working wonderful. Everything is working wonderful when it can meet all the biological needs. But it doesn't happen in the world, in our reality. Our reality is so unpredictable, is so changing. And one day it may happen, and it happens for every one of us every day, sometimes for the day, that we have something that we can bring it, take it, or we have something that we want, take it out, but we can't. And it's create biological conflict. In my cases, my biological conflict, it was the place that I don't want to go to the place, to the work, because it was different. It was not me. It's maybe everything in our life. We know a lot of biological conflict. It's maybe, for example, I don't want to touch me, or I want that somebody hug me, or I feel not enough in this situation, or I can feel I need something and I can't catch this. We have a lot of biological programs. What it happens if we experience event in our life, and we experience this event, the situation, as like unexpected. And everything in our life, it's unexpected. You experience it in dramatic way. It's like, for me, it was dramatic to be in this situation, to feel like I felt. And we experience this in isolated. We feel alone, that nobody can understand what I feel, or I can speak about this, or I speak, but I have some feeling. No, I not hear it. They not hear what I say. If we have three of these things together, unexpected, traumatic, isolated, the name of this phenomena, Dirk-Hammer syndrome, on the name of Dr. Hammer's son. Significant biological special program is starting. And what it's important to say, what I say about here, it's subjective assessment of the conflict situation. We can take 5 people on the same situation, and these people can feel differently in other things, and they can go through the process of different organ in our body. Please remember, for activating significant biological special program, we need 3 of these conditions: unexpected, traumatic, isolated. And when we have 3 of them, significant biological special program is starting. he's starting to work on the 3 level. One of them is psyche. What is this psyche? It is my thoughts. It is my feeling. It is my behavior. It is my, like how I see the world. It's what going, how I feel, how I see, how I think about all the things, what happens. It is a brain. Brain, it's the, it's like part of computer that working with all our body. As we have, it's going to do the change in our brain and one of our organ. It's very important to know all the 3 levels, it's working together, synchronized. The differentiation between the psyche, the brain, and body is purely academic. In reality, they are one. It's the word of Dr. Hammer. And we see the first biological law, first criterion, every so-called disease. And Dr. Hammer say it's no disease and no healing. It's only significant biological special program originated from the Dirk-Hammer syndrome, which is an unexpected, highly acute, dramatic, isolating conflict shock that occur simultaneously on the psyche, brain, and corresponding organ. The content of the conflict determines which organ will be affected and from which area of the brain this biological program will be controlled. And the third criterion, every special biological programs runs synchronously on the level of the psyche, the brain, and the organ. And this topic I share with you the basic of the first and the second biological laws of German new medicine. I don't dive so deeply, but we need this basic knowledge to understand the technique that I want to teach you. The second biological law, every significant biological special program runs in 2 phases, provided there is resolution of the conflict. For so many years, as a doctor, I know about only one phase, when the people come to me with some diseases, but actually it is 2. Here we can live our regular life, everything is good, everything is working, and suddenly, unexpected, highly traumatic, something happens and we feel with it alone. It's the Dirk-Hammer syndrome. And the special biological program is starting. And this program goes through the 2 phases. The first phase is its conflict active phase. What happens here? Here we're so busy in our psyche level. It's my thoughts, what happens and what I'm thinking about this situation, and I'm feeling sad, or I'm feeling fear, or I'm feeling everything, a lot of feeling or one feeling, and all my thoughts, all my feeling about this situation. And our sympathetic system working more. And in this situation, we don't want eat, we don't sleep, we're very active. We have cold hand, cold arm. We're so nervous, and we have reason for this. This is working because we need to solve this biological situation. Something happens, and the best resolution is to solve it. On the psyche, it's so active, and on the brain and organ, we have some change, but we didn't feel. And on the organ, we have some change, but usually in 95% of all the biological program, we don't feel these changes in our organ. And after this, come resolution for this problem. Like in my case, I understood what happens and I decide to go out from this work. It was resolution, it was conflictolysis. And all the three levels went to the healing phase. Healing phase actually working in parasympathetic system. And this system, we feel so tired, we don't have no energy, we only want to eat, to sleep. On the psyche level, we quiet because it's no conflict more. And I feel so quiet, so good. It's like, you know, I can say it's like if you're going before exam and you, wow, what it be, how it be, right. I'm start to write my exam, and this time it's all my stress can go out, because that's all now I am in exam. It's conflict resolution. As on active phase, people active, and on the healing phase, people want to sleep. People want to sleep. People want to rest, to eat. But on the brain and on the organ level, changes starting, and we can feel them. The changes, it's inflammation, it's a fever, it's a pain. All the disease, it's here. Pneumonia, it's here. It's back pain, fibromyalgia, urinary tract infection. I think almost every disease that I know, a lot of them came here. I say, like, you know, here I have psychological problem because my psyche is so active, but I don't feel on my body some change. But here I'm going to be quiet, but the symptoms started. And here we are going to the psychologist, and here people coming to me, to the doctor. I have my pain, I have my phlegm, I have my biological program is running till it's finishing, and we have some scare or some little change in our body, but we are healthy. We feel, again, we feel good. We can live our regular life, and we went stronger than before. The conflict is came and starting this biological program. Biological program is good. It is a part of our nature. If it's so good and natural, you can ask me why people have a chronic disease, why people have a cancer, why people can die from this disease. And now we are going to speak about some mechanism that can start and continue the chronic diseases. We have two phases, conflict active phase and healing phase. And we know that approximately the same time that we was in conflict, that conflict was active, for body take approximately the same time for healing phase. What does it mean? Here I was in psychological conflict, and after this symptom coming, and I'm going through the physical symptoms. And what happens if we have long, intensive conflict, active? At the same time, we will have long, intensive symptoms. What does it mean? It means if I was in my biological conflict, if I was in biological conflict for 1 year, it's take approximately 1 year till I can finish this program and I came to my health. For example, in my case with kidney tumor, it took 4 months from I discovered this tumor until it's go through the healing process, and on the CT I discovered it only scared. Okay, it took approximately 4 months. What does it mean? I was approximately 4 months in active conflict. But if somebody 1 year or 2 years going through this conflict and live in this active conflict, after conflictolysis, it will take 1 or 2 years of intensive symptoms, on your body. It was the first mechanism of created chronic disease. We want conflict active phase be short as possible. As short as will be healing phase and phase of symptoms. As short will be all the program. Another mechanism. For example, I was in some conflict, active conflict about my self-devaluation, something that's I can do it, I can speak, I can not, I don't know. And I was all the day on my work was in this conflict. I came back home and I released it, and I felt good because I at home, my people, my beautiful family. And in the evening, at night, I started to feel back pain. What we usually do when we feel some pain, especially back pain or especially some pain in our body? Wow, I woke up in the morning. No, now I can see it, I can lie, I can walk in. How can I drive to my work now? What happens? I can't. In the evening, it was resolution of the conflict. But in the morning, I started the secondary conflict or the same conflict of self-devaluation. When I started this phase, here I don't have a pain, okay? And the day it feels better, or no pain, or a little bit pain. But in the evening, when I came home, It's again solution for my conflict. And it's again go through the bigger symptom. And people can go in this loop and live in this loop days, weeks, months, years. One of the biggest example is fibromyalgia or chronic back pain or arthritis, some rheumatological diseases, what we say about this. Usually it's going through this loop, it's going and circle and circle and circle again. That is the second mechanism of creation of chronic disease. And the third mechanism is tracks. You know, we have some inbuilding mechanism in our body. When something happens, some traumatic situation, our subconsciousness is do flash it like snapshot of everything it's around us. This white wall, I have this crystal, this green flower, word, people, smell, visual. It's maybe everything, everything. And we have biological reason for doing this snapshot. Because if the next time I can smell this rose, or the next time I can see this woman, or the next time I can hear this word, all my system in the body say, danger, 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 don't go there. It's built-in system in animals and in us, the human, to prevent that we going through the same dangerous situation. But we are people and we have this box and we go again and again for the same situation. And what happens? It was some situation that was activated, but was some situation. And Dirk-Hammer syndrome was there. It's something unpredictable, traumatic, and I feel isolated with this. It's activated some biological program. It's going through the active phase, and after this conflictolysis, and it's going through the PCLA phase, but it didn't finish. And suddenly I met this track, this smell. And what happens in my body? Immediately, biological program, it's activated again, because I don't have a reason for this, but this track say it's something dangerous was here. And this was activated again and go through the healing phase, but didn't finish it. And track came again. And again, it's active phase and healing phase, and active phase and healing phase. It's the mechanism of allergic diseases, of creation of a lot of chronic and serious disease. Okay, now after we know these three mechanisms, what we can do with it. The biological program is activated only when we have all three of them: unexpected, traumatic, isolated. If I take out one of them, if I stop one of them, if I neutralize one of them, the biological program go to the healing phase. If I can take out unexpected, no, it's impossible. But I can't work with traumatic or isolated. If I stop my isolation, active conflict phase go through the healing phase, and it's short biological program. Let's see it again on this graphic. For holding conflict active phase, we need three things: Dirk-Hammer syndrome, and we need it that will be unexpected situation. We feel traumatic in this situation, and we feel isolated in this situation. If I neutralize isolation, and now we're going to speak about this, we stop conflict active phase, and PCLA phase start. What does it mean? Does it mean we going to short conflict active phase, and it will to short our symptom phase? Do we want to do this? Now we are diving in this topic. What is feeling of isolation? What is this isolation? That I have something that I don't speak with another people because I think it's a very intimate place, very intimate things. Or I think it's so small, so not important things. It's maybe for another, it doesn't matter. Or I go and speak with somebody, but people immediately give me advices. You can do this and you can do this. And how do you feel with it? I'm isolated, I'm alone with this. I say it's like a road block on my way. I have three techniques to neutralize our isolation. Sometimes when I say I'm okay, I want someone to look me in the eyes, hug me tight and say, I know you are not. The first technique is sharing. What does it mean? You go with your friend, you find some people that you can speak with them open, without filter. I say it's, like without filter, you can say everything that you want, and you only speaking about what is your worry, about what you are afraid. You sharing with these people all the things that you have obsessive thinking about this. Like I came from my work and something happens in the work, and I sit with my partner. I only sharing with him. It was like Kicha, and she did this and she did this, and I felt like this, and only speaking, sharing. We don't need another person to give advices for what to do with this situation. We only need the open space that we can share what it's hurt me. That's all. After this type of sharing, people describe it like I actually release something. And it was so good on my heart. And after this, if it was a long time of active conflict, you can start with your symptoms. And it is good because you are going to the healing stage. If you don't have some person that you can openly speak with them, you can do the second technique, writing. You then take some paper and like you want to speak for somebody, you starting to write. Take you writing without filter, without thinking. It's like, it's like intuitive writing. You know everything. It's you come out from your mind, from your emotion, from your perception. You only writing and writing and writing and writing. It's like you release it to the paper. It's work good. In the second technique, I don't think it's appropriate for everybody, but a part of people use the technique without knowing this, and they share in social media. When these people sharing in social media, it doesn't matter for them if somebody writes the answer or somebody says something. Therapeutic action of this is to share, okay, to release. Like here, I'm tired physically and emotionally, disappointed in some family, friends, and officer for some la 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 la. This somebody, I don't know who is it, only share his disappointment. It's a release. And after this release, you're going to the healing phase. I invite you after this lecture to find if you now in some active conflict, if you have some obsessive thinking, if you have some obsessive emotion, try one of 3 techniques. And please write under this video how it was for you, what it do for you, what is the result of using this technique. Simple, genius things are simple. And this technique are so useful and so simple and so effective. And what happens if we have event in our life that we experience it unexpected, traumatic, isolated? And if we're going to neutralize our traumatic perception of this situation, we have situation, we have an event, and we have our perception, our individual perception of these things. But we can change it. If it's so easy, it's more profound things. When we're changing our perception, we say it's a deep work. We're going through the evolution and growing. And what happens? We're going through the healing phase. But after this, we don't need anymore this biological program. And in the next time, when I really will change my perception, I don't need anymore this biological program. It will not activate it again. The moment you change your perception is the moment you rewrite the chemistry of your body. Bruce Lipton. Like these people, for somebody, it's the death. And for somebody, it's honey. It's only a point of perception. From my perspective, when we making German new medicine as a part of our daily life, it's contribute greatly to our personal growth, evolution, and development. And the next time when we're going to meet the next biological program, we can choose to take a pill, or we can choose to take a responsibility for our health, life, and healing. I'm so grateful to be with you here. I know that my English is not so brilliant, but it was important to share with you my understanding of this brilliant knowledge, German new medicine. See you